you got to be asking the same question I am, right? Which is, at what point do we stop trusting our experts? You know, how many times can they flip-flop back and forth, like literally say the exact opposite of what they said last month? I mean, we watched it with Tony Fauci, we see the imperial model. We've covered all of these things, but it starts begging the question, have they said anything that was correct? Just to give you a sense, when you think about the WHO, remember, at first the WHO was telling us, oh, well, masks won't do you any good whatsoever. There's no point in wearing a mask. And then, we saw headlines about that. WHO calls on nations to encourage the public to wear fabric face masks where coronavirus is spreading. So they sort of flip-flop back and forth. Didn't we have the first one? I thought we had the original where they said you didn't need to wear it. Anyway, so now, this week, though, I think of all of the things I've seen, there was a massive flip-flop that we all watched that was incredibly shocking. Because think about it, all of the contact tracing, all of this discussion about testing, all of it has to do with asymptomatic carriers, or super spreaders, as they're now being called. I've been telling you from the very beginning, that's just simply healthy people that are so healthy, their immune systems just obliterate COVID-19 without even feeling it. That's what an asymptomatic carrier technically is. We've been hearing the numbers are gigantic. Well, then all of a sudden there was a headline that rocked the world. It was everywhere. A WHO scientist came forward and said, actually, that asymptomatic carriers shedding or spreading the virus was very rare. Coronavirus spread by asymptomatic people appears to be rare, WHO official says. I mean, everyone was covering this, right? There was headlines everywhere about it. Here's CNBC, asymptomatic spread of coronavirus is very rare, WHO says. And of course, it's swept all over the world. Everyone's, and I honestly, when you read these articles, I was thinking, then what are we doing here, right? Why are we going to contact trace if it's very rare? What are we talking about then? But then, of course, within 24 hours, the WHO then reverses that course, and then we start seeing these headlines. WHO official walks back statement that asymptomatic transmission is very rare. In fact, here we go again, WHO official takes back comment that asymptomatic virus spread is very rare. And something that I found truly annoying is the fact that anybody that had posted video of this WHO official, whose name is Maria Van Kerkhove, I believe is her name, anyone that had posted that video, they are putting a false information or incorrect, here we go, partly false information across it. So now apparently fact checkers are cleaning up the misstatements or mistakes by authority figures. Is that what social media is supposed to do? Oh, can you imagine how much President Nixon would have loved to have Facebook and YouTube on his side during those days? Well, I mean, he didn't mean that. Or, Woodward and Bernstein don't have any proof, so we're going to false flag that. I mean, we live in such a crazy time. But if you just sat and watched these headlines going by, your head is probably spinning. I mean, and I'm asking myself, is that the reason? Are they just trying to make us so confused we can't see straight? But before we try to answer that question, I really want you to, most of us, we see the headlines, and we probably don't even read the article, right? We're all just a bunch of headline junkies, and we go, oh, there it is, then I guess that asymptomatics don't spread. Oh, well, I guess they do. And we all move on. I want you to really hear the original statement. Let's go through this. This is the WHO official explaining how asymptomatic carriers spreading to other people. The coronavirus is very rare. Listen to this.
What proportion of asymptomatic individuals actually transmit? So the way that we look at that is we look at these individuals need to be followed carefully over the course of when they're detected and looking at secondary transmission. We have a number of reports from countries who are doing very detailed contact tracing. They're following asymptomatic cases, they're following contacts, and they're not finding secondary transmission onward. It's very rare. And much of that is not published in the literature. From the papers that are published, there's one that came out from Singapore, looking at a long-term care facility. There are some household transmission studies where you follow individuals over time and you look at the proportion of those that transmit onwards. We are constantly looking at this data, and we're trying to get more information from countries to truly answer this question. It still appears to be rare that an asymptomatic individual actually transmits onward.
didn't seem like there's a whole lot of confusion inside of that statement. I mean, it sounds like she's really looking at, you know, studies. She says, now I'm looking at things, and obviously she's privy to things we aren't, right? She's a head scientist at WHO or spokesperson. So what she's saying is behind closed doors, we're looking at these very in-depth studies by experts, some of them not published yet, but I'm sharing this information with you. And then she sort of doubles down at the end. But I mean, what we're looking at, it's rare. You know, it's rare to see a spread by an asymptomatic carrier. But obviously, you can imagine what happened. What does Tony Fauci think about that? What is Bill Gates going to do? What are all these people that are pumping the fact that we're supposed to be terrified of being personally? Aren't I wearing a mask right now because I could be an unknown super spreader? I'm walking around healthy, but I could be carrying it, and possibly I'm going to get grandma killed. I mean, you see, this would destroy the entire world narrative, wouldn't it? I mean, what's the point of locking down? What's the point of a mask? I was shocked. I was like, wow, this is amazing. And then, you know, all of a sudden, as we said, it flip-flops the very next day. Sort of not surprisingly. But then when I said, well, what did she actually say to correct it? Take a look at this. And you tell me, does this sound like a 180-degree correction? Here you go.
What I was referring to yesterday in the press conference were a very few studies, some 2 or 3 studies that have been published that actually try to follow asymptomatic cases, so people who are infected over time, and then look at all of their contacts and see how many additional people were infected. And that's a very small subset of studies. And so I was responding to a question at the press conference. I wasn't stating a policy of WHO or anything like that. I was just trying to articulate what we know. And in that, I used the phrase very rare. And I think that that's misunderstanding to state that asymptomatic transmission globally is very rare. What I was referring to was a subset of studies. I also referred to some data that isn't published. And this is information that we receive from our member states through either presentations that they give at member state briefings or presentations that are given to us through teleconferences. As you know, and as we've said previously, we convene global expert networks. And at many of those, we discuss a lot of ongoing research, ongoing studies that are there. And I was referring to some detailed investigations, cluster investigations, case contact tracing, where we had reports from member states saying that when we follow asymptomatic cases, it's very rare, and I use the phrase very rare, that we found a secondary transmission. What I didn't report yesterday was, because this is a major unknown, because there's so many unknowns around this, some groups, some modeling groups have tried to estimate what is the proportion of asymptomatic people that may transmit? And these are estimates. And there's a big range from the different models, depending on how the models are done, and where they've done, from which country. But some estimates of around 40% of transmission may be due to asymptomatic. But those are from models. And so I didn't include that in my answer yesterday, but wanted to make sure that I covered that here.
I mean, who can take it? Have you ever heard? I mean, honestly, you know what I think is happening there? We do blame science. We are like starting to feel like scientists are just criminals. They're lying to us. What I actually think you have there is someone, Maria there, I don't think she can actually lie. And we've all worked for that boss, right? We've been in that position, whether you're in a restaurant and you messed up somebody's food and you just got to go as the waiter and take the fall, right? Obviously, behind closed doors, Fauci's calling in, Gates is calling in, everyone's saying, who is this idiot speaking for the WHO? I thought we weren't going to tell the people the truth. Wasn't that the deal? Did we say, if you are going to decide to tell the people the truth, you call me first, right? My name's Bill Gates. You know who I am. I'm funding the World Health Organization. You want to make sure you give me that call next time, because this can't be happening. And for all of my friends out there that keep referring to the cabal of the world takeover of the Illuminati, all I gotta say is, if that is true, it's an Illuminati of clowns, okay? I've never seen a bigger bunch of clowns in my life. These people cannot get their story straight. I mean, how is it that the WHO just spouts off actual facts without having Tony Fauci know that that's what she was about to say, or Bill Gates, or all the other players in this entire thing? Now, my point being, I mean, listen to what she said, right? She's essentially saying, well, what I meant to say is we have global expert networks, right? Expert networks that have really good data collection systems. And when we look at those, their results are coming out very rare. But when we, you know, I forgot to mention the other group, those mathematicians that don't, you know, well, let's play it again. Just play the last part there.
And I was referring to some detailed investigations, cluster investigations, case contact tracing, where we had reports from member states saying that when we follow asymptomatic cases,
when we actually follow
it's very rare, and I use the phrase very rare,
and we get real
that
data,
we found a
it's
secondary
really rare,
transmission.
and that's what we found
What
there.
I didn't report yesterday was, because this is a major unknown, because there's so many unknowns around this, some groups, some modeling groups have tried to estimate what is the proportion of asymptomatic people that may transmit. And these are estimates. And there's a big range from the different models, depending on how the models are done, where they're done, from which country. But some estimates of around 40% of transmission may be due to asymptomatic.
Right.
But those are from models. And so I didn't include that in my answer yesterday, but wanted to make sure that I
gave you facts. I mean, it's crazy, right? I mean, you see what she's saying? It's absolutely nuts. And I think the only way, you know, I really thought, like, what is that doing in my head? There's really only one way to state it, and I think it was best stated once by President George Bush.
There's an old saying in Tennessee, I know it's in Texas, probably in Tennessee, that says, fool me once, shame on you. If fool me, we can't get fooled again.
You know, we sat around, honestly, I sat with my team and said, okay, we're trying to get through this, right? We're trying to get to sanity. We've proved that the numbers have been off. We know the models are terrible. Are they, and this was the question I think you're probably asking too, are they doing this on purpose? Are they purposefully just being confusing to somehow, you know, stay in control? And when we all sort of went through it and really laid it on the table, it just doesn't seem that you're going to hold on to the mind of America and keep us terrified by acting like a bunch of flip-flopping clowns with big red noses on that can't seem to get anything right. So I'm going to just assume what I'm saying. This is the biggest mess. It's a quagmire, it's a disaster, and while it's all going on, I don't think it's on purpose, folks. In fact, it's why I have a really good feeling we win this, because if you have half a brain cell, you're more organized than the people that are trying to make you terrified.
If you like that clip, then be sure to check out our live broadcast of the HighWire every Thursday morning at 11 a.m. Pacific Time. You can watch it on Facebook, YouTube, iTunes, and Twitter. We'll see you there.